If you care about mental health, care about your weight and your energy levels, you have to care about the because if it's not healthy, you're not healthy.
Dr. Will Cole, best-selling author, one of the top 50 functional medicine practitioners,
and is a health expert for the world's largest wellness brands such as Goop.
There's so much medical gaslighting going on. The average conventional doctor would fail a basic nutrition test. And I find that to be problematic because you have the worst healthcare system, yet you're criticizing people that are trying to do something different.
You define yourself as a functional medicine doctor?
The differences between mainstream medicine and functional medicine is they're trained to diagnose a disease and match it with the medication. But I think a nutrition forward approach to healthcare is vastly important.
Why?
Because the vast majority of health problems are lifestyle driven. Foods we eat, exposure to toxins, these lifestyle things are really what's plaguing our society. 60 to 80% of all Western countries are dealing with some massive metabolic issues, in part fed by chronic stress. Part of our trauma in our life has to do with the trauma that our ancestors have gone through. It sounds science fiction, but looking at how trauma is literally stored in the cells and then passed through family lines is very much science.
Are you optimistic that there's things we can do to change it?
As trauma can be inherited, so can healing. There's three. Yes, I'm a functional medicine doctor.
What does that mean?
So if I had to break it down, the differences between conventional medicine and functional medicine, mainstream medicine and functional medicine. First thing is we interpret labs using a thinner reference range. If you know, you get your lab and you have your number and you have this X to Y interval, this reference range that your GP or PCP is comparing you to. We get that reference range largely from a statistical bell curve average of people who go to that lab. It's non-standardized for the most part. People that are predominantly going to labs are people, sadly, going through health problems. So a lot of people know intuitively something's off here. My fatigue, my brain fog, my digestive issue, my hair loss, whatever it is. They go to the doctor and the doctor runs the basic labs. And they say, look, the labs pretty much look normal. You're just depressed. You're stressed out. What they're unintentionally telling the patient is they're a lot like the other people with health problems that they're being compared to. Just because something's common doesn't necessarily mean it's normal. Comparing yourself to people with health problems is no way for you to find out how you can feel at your best and why you feel the way that you do. So in functional medicine, we're looking at optimal, not average. So the Cleveland Clinic here in the United States has a functional medicine center. Many mainstream institutions have functional medicine and integrative medicine institutions. And all of us in functional medicine are trained through what's called the Institute for Functional Medicine. So we're looking at optimal, not average. We're running more comprehensive labs to get to the root cause, because ultimately speaking, none of us are sick from a pharmaceutical deficiency. You're not gonna like pharmaceutical your way into health one day. They are disease managing medications and are needed many times. But ultimately, we ask the question, what is your most effective option that causes you the least amount of side effects? And for some people, medications fit that criteria and they need to be on it. But oftentimes medications really don't fit that criteria, yet it's the only option given to them. And there's a root upstream causation as to why they have to be on that disease modifying medication in the first place. So we're looking at things like underlying gut problems, chronic infections, nutrient deficiencies, hormonal imbalances, or things like trauma and shame, the things that I'm talking about in my latest book. And ultimately, it's predicated on bio-individuality. We're all different. And even good things, even healthy things that's relevant, that's pertinent for one person may not be relevant for you. And even healthy foods, what works for one person may not work for you. So it's really curated, customized, evidence-based medicine, in short. And showed that in this one group, that the average conventional doctor would fail a basic nutrition test because of the training that's not there. And any conventional doctor will tell you, and actually most of my colleagues in functional medicine are conventionally trained, and they will tell you they have to go to postdoctorate training to even learn about nutrition. And I find that to be problematic because we're dealing with the vast majority of health problems that people are seeing are lifestyle driven, meaning that the foods we eat or not eating, our stress levels, our sleep, our exposure to toxins, these epigenetic lifestyle things are really what's fueling what is plaguing our society and what the major like endocrinologists, PCP, GP are seeing on their day-to-day visits. So I would say the approach is different because there's a place for medication. Again, I mentioned that sort of litmus test of maybe a piece to your puzzle, but ultimately it is not the totality of what's going on here. And we have to look at in my opinion, a both and, not an either or sort of reductive tribal approach. And that's where I think functional medicine attempts to bring things together, where it's not us versus them. It's, well, what is the most effective tools within this person's toolbox? And medications may be part of it, but there are oftentimes a lot more effective, a lot less side effects tools within that toolbox.
And you mentioned food a second ago and the role that plays, the foods that don't love us back. What are the foods that don't love us back?
I'm going to lose some friends right now on this podcast, but it's what I would call the inflammatory core 4 plus 1 if I can, but the would be gluten containing grains would be on the list. That's things like wheat and rye and barley and spelt. And sort of nuanced conversation about this. Is it really the grain, or is it what we've done to the grain? I think it's more what we've done to it. We're not properly preparing it, plus we're hybridizing it, we're spraying it with tons of stuff, and then we're over consuming it, right? We're over consuming a famine food. We're feasting on a famine food that historically was stored well, and now we're always consuming it, let alone what we've done to the crop and the soil in which it's grown. But for the sake of simplicity, I think the average sort of wheat that people are consuming is triggering a lot of inflammation levels, definitely doesn't love the human species back very much. And number 2 would be industrial seed oils, things like canola oil, vegetable oil, soybean oil, these things that are not, I mean, this is kind of controversial for me to say in the health space. I don't think that they are inherently bad. I think they are just overconsumed because we need healthy ratios of omegas 3, 6, and 9. When you think of omegas 3s, it's like the healthy fish, right? People, or like the healthy long chain omega fats you get predominantly from fish. People are not having enough of those healthy omega 3s, having a lot of these seed oils that are in a lot of packaged foods. So I think it's just the overconsumption of one and not eating enough of the other. The third would be conventional dairy. By conventional, I mean there's the average dairy that you're getting, the milk that you're getting at the grocery store. There are better versions of it when you're looking at grass-fed organic A2 milk you'll see popping up, because beta A2 casein is the subtype of casein that would have been consumed by humans for thousands of years. Now, because of the crossbreeding of cows, most casein is beta A1 casein, which has been shown to be more inflammatory because, again, of this evolutionary mismatch. Our ancestors wouldn't have consumed all of this. The fermentation of dairy can make it more digestible because it's breaking down the casein, the dairy protein, and those dairy sugars. So things like kefirs, cheeses, and yogurts can be more digestible. And the fourth would be sugar and the overconsumption of that. But most people know that. But I would be more mindful of even the nice sounding euphemisms for sugar, where it's like, oh, it sounds like agave nectar. I think of that, right? Agave just sounds so natural, like they're squeezing the agave in the cup and just consuming it. It's mostly marketing because it's still sugar and it's still high in fructose. So I would be just mindful for the listener out there to look at the grams of added sugar you're consuming in a day, no matter where it comes from. And then the plus 1 would be alcohol, which is really a saboteur to our gut feeling connection. It will impact our gut microbiome. It's been shown to increase leaky gut syndrome, really raise systemic inflammation, and it's a neurotoxin. Researchers have shown that even drinking a small amount a few times a week is associated with lower brain volume, lower hippocampus size, which we need for focus and energy and having optimal cognition.
You were vegan for 10 years, weren't you?
Mm-hmm.
Why are you not vegan anymore?
You did your research on me.
Yeah.
I was a vegan for a while. It didn't love me back. It worked for a while, and I think that's and my first book was called Ketotarian. It really was that exploration of being that health nerd and trying something new and feeling great and doing it in a whole food based way, and then evolving from it and realizing it didn't love me back. And just because something's better, meaning Just because something's better than the standard Western diet, which it certainly was, doesn't necessarily mean it's optimal. And it's okay to pivot. It's okay to evolve. So for me, I talk about it in Ketotarian, but I wasn't getting the complete protein that I needed. And a lot of the proteins that I was getting really wasn't working for me on a digestive standpoint. It just was like a lot to digest. It was kind of irritating my system. And there were some nutrient deficiencies from a bioavailable iron standpoint, bioavailable B vitamins like folate and B12 standpoint, and true vitamin A, retinol, which you cannot get in plant-based form. Now, in theory, I could have supplemented with all of those things. I could have supplemented with iron. I could have supplemented with B12, which I was, and I could have supplemented with vitamin A, which I was. But there's synthetic mainly. The retinol that you're getting from supplement form is synthetic. It's not in its whole food form. So the question that I posed to myself was, if I have to supplement, is it really the most ideal diet for me? So I have many patients that are vegan for various reasons, like religious and ethical reasons. And we want to make them the best vegan or vegetarian, if they're vegetarian, food protocol for them. But for me, I was able to pivot out of that, where I could still be predominantly plant-based, but still be omnivore and feel amazing. So that was my journey.
What were the physical sort of symptoms that you experienced that made you awaken to the idea of pivoting out of being vegan?
It was fatigue more than anything. It was fatigue, brain fog, and digestive problems.